into researching, who is a research neuropsychologist, and as I said, with more than 30 years experience looking into researching, trying to figure out what this Gulf War illness is all about. Welcome, Doctor.
Thank you.
Fair use.
I guess let's get started with what is Gulf War illness?
Yeah. So what's really interesting is that when individuals first came back from the Gulf War, they were starting to experience a number of different health symptoms. And the symptoms were not meeting criteria for any sort of typical disorder. It wasn't post-traumatic stress. It wasn't, chronic fatigue. It wasn't anything that anybody had ever seen before.
Okay.
There was a multiple number of systems that were involved that actually led to this disorder being called chronic multi-symptom illness or Gulf War illness.
Okay.
And reason being because it was interfering with a number of different things in people's lives. So it was, fatigue, it was mood, it was cognition or thinking, memory, aches and pains, skin rash, respiratory problems, irritability, you name it.
Interesting. I know I'm myself a Gulf War veteran, and luckily, as of yet, I have not experienced any of the symptoms you're talking about. But I knew I had folks in my unit who did, and it even went so far. I had one individual who his wife became pregnant, and then they lost the baby due to sudden infant death syndrome, and they were trying to tie that to it. He had multiple symptoms. So I know this goes all over the place as far as what's going on. Have you guys been able to narrow down, any of the causes? Has anything popped as far as what caused Gulf War illness?
So over the years, with a number of different research studies, both through VA and Department of Defense, what has really been shown time and time again is that it's the number of different neurotoxins or toxicants that were, just got into the body, into the bloodstream, into the brain, and people have just developed numerous different systems as a result. Okay. So the vaccines, of course, that people took before going, the pyridostigmine bromide pills, the anti-nerve gas pills that people took while they were there, and certainly the number that people took, the worse the symptoms were.
Okay.
All of the different pesticides that people were exposed to. The pesticides were coming both from in country and coming from here. People weren't even sure what they were using or what they were being exposed to. But I'm sure you remember, pest strips hanging even in the indoors when they weren't supposed to be, and pest strips by food, sprays.
Yeah, I just remember the bug spray.
Exactly.
Trying to keep the flies away and all that stuff.
Yeah. People dipped their uniforms in pesticides and then wore them or wore flea collars.
Nope, never did that either.
Yeah.
That seems, that's...
So, it was sort of like, do we do this and not have other, mosquito-borne illnesses, et cetera, or, people didn't really see the risk. And also DEET, DEET was used in very, very high levels. And then, of course, people who were there during the oil well fires.
I was going to ask you about the oil fires.
Right, the smoke from the oil wells. People who were there, with the, who had sirens go off for chemical alarms, the sarin exposure. There were just so many different exposures that led to these disabling conditions. And most of the conditions are really tied back to central nervous system disorders.
Okay.
So brain, really.
Right. And I think what's interested me is, just harking back to, say, Vietnam, people understood, okay, they were exposed to Agent Orange as an example. but like they didn't come home and immediately, for the most part, most folks didn't immediately. It took years or over time. This seems to have literally hit. I mean, some people were experiencing issues in country, and
Right.
then so this was
Right.
like very, very quick. It came
Mhm.
on very quickly.
And that's really a good point, because we know that people like who had the vaccinations and had multiple vaccinations all at one time,
Oh yeah.
right? Those individuals got sick right away. And you know, it was interesting because when people first came back, we asked questions that we ask very differently today. Because the typical experience was, if you had a toxicant exposure that was going to cause health effects, you had to experience something right away. But, you know, after time or over time, we realized that these exposures invade the body, right? They really, you know, they cross the blood brain barrier and they get absorbed into different parts of the body and cause these debilitating effects. So even if you didn't have an initial bad experience, and of course some people did, but others did not. But just in the way that, you know, if it's on the skin and it gets absorbed and
Sure.
absorbed into the bloodstream, or, you know, if you're breathing it in and what is that, or smelling
Right.
it. So a lot of it is just, you know, more about
What up,
what we
Adrian?
know now, or what we've known really as a result of this conflict.
Yeah, I mean, my own experience. I can remember they pulled us through the gym, the brigade gym, and there were medics on either side, and nobody even cared what your shot record said. You just basically took off your uniform jacket, you rolled up the sleeves on your t-shirt, and you walked down, and it was like both sides, boom, 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 boom. And I have, to this day, I couldn't tell you everything that went in.
Mm-hmm.
And then you got I forget what it was called, but the big one in your fanny that felt like
Right.
that was supposed to be like this giant kill all or something. And
Right.
yeah, it was. It felt like a mule kicked you, but
Mm-hmm.
but yeah. So I can understand all the all the medications or whatever, the inoculations that we all received going out the door.
Yeah, I mean, I see them, and this is from the VA. This is from the VA YouTube channel here. U.S. Department of Veterans Affairs. So no comments allowed. But I could see them. I'm sure that some of this stuff is correct. All these chemicals and all this different shit, you know. I mean, but there's got to be some. There's got to be. How do you say it? There's one similarity that pretty much everybody in that theater has, and that's fucking walking down that gauntlet and getting stabbed in both fucking arms with who knows what, you know what I mean? And then obviously the anthrax. And the anthrax, you couldn't deny an anthrax shot until after 2004 is what I've come up with here researching. I mean, I knew when I was in, you couldn't not take it. You had to take it. You know what I mean? Or be fucked. You know, wasn't very good at playing by the rules anyway, so I was always in trouble. But I think it's a lot harder for them to just say, "Hey, it was all the shit we stuck you guys with." And I don't know, people. If anybody's wondering or asking, why am I harping on this last couple days so hard? Well, like I said, I got shit going on. First of all, with feeling like shit and going to the doctor and having different problems, you know, fatigue has been the big one lately. And then running their tests, you know, the civilian side, my doctor and everything, and them not being able to find any answers or help me with any solutions, you know. So it's beat it to death, I guess, this last couple days for me anyways, because I see people lining up around the block and I see people trying to go be guinea pigs for this other jab that's out there. And you don't have to. You're a civilian. You don't have to. You know, you're a citizen. You're an individual. You're not binded by some contract to the federal government. So, you know what I mean? You have that choice. And I don't know. I sent Bikes and Bullets a text to see if he jumps in, but or any of those fellas, those vet fellas, they can tell you like, there was a time where you can't say no. I think the military is way different now. You could have you get phone calls home and shit and stress cards and all this shit to make the military a bunch of, pussies. And so the military is a whole nother animal now. And you have that option now, when back then you didn't have that option. You could get UCMJ, NJP, brig time, just get fucked with by your chain of command without actually receiving any punishment other than, them just torturing you basically. But
and then it's interesting to hear.
As a civilian, you don't have to take
experience
that poison
a lot of the
jab.
stuff you're
So
talking
I don't know.
about
I
just
found
because
this and I'm
I
sharing
was in a
it. See
more
what you guys
forward
think.
unit. We lived on our tanks. I didn't even see a flea collar or something you tried to use spray to keep the flies away. But interesting. I mean, it's and that's a great point too. It's like, most of these, when you talk about a lot of these illnesses, it's people in later in life who are developing different forms of cancer,
Right.
or, and this was literally, like I said, I remember people, as soon as we got home, they were like all screwed up.
Mm-hmm.
So, I mean, you touched on it a little bit, but, as a Gulf War veteran, what symptoms should I be looking for even today? What should I be worried about even today?
Right. And so, I mean, what's been really interesting is that the symptoms have seemed to, some of them, have like waxed and waned over time.
Okay.
So the skin rash that was so heavily prevalent early on when people came home might be less of an influence right now. What we are tending to see, however, is that individuals are aging badly. And by that,
Okay.
what I mean is, in some of our own studies, and certainly in studies that have been done by other, VA centers or by Department of Defense, that individuals are developing things like, dementias earlier on, problems with memory, or people are developing diabetes at an earlier age, or heart disease that you wouldn't normally see until 50s and 60s, which is mostly what people are now, but we saw these when they were in their 30s.
Yeah, wow.
So some of it, and even on neuropsychological testing, like in terms of memory and motor function, people were actually like 7 to 10 years older in performance levels than their age. So, if you came in, you were 30, you would be, scoring like you were a 37 to 40-year-old, which might not seem that big, but as it expands over time.
Right. When you're 50 and you're testing out at a 75 to 80-year-old or something.
Exactly.
That's a whole different ball of wax.
Exactly.
So, when I talk to people, that were not in the military, people that I know in real life, and they're on the fence about getting the jab, I always bring this up just because, you know what I mean? If you have real world experience with getting screwed over, then you will try to stop somebody from committing that same mistake, or, making that same mistake. And so, yeah, I've been going to the doctor for fatigue, for the joint and muscle pain, for the fucked up stomach. I mean, my stomach has been fucked up, and all these symptoms that I have, the not sleeping and then the skin problems, was right away. Skin problems and not sleeping right away. So I don't want to tell all these stories over again. I've already told them the last couple of days in the videos, but so going to the doctor for all this stuff, because as I get older, they're worse. You know what I mean? There's not really a day where I wake up and have an awesome day where I feel fucking like $1 million all day. So when people ask me, or if they want to argue with me about getting this jab ski that they're trying to get a free donut to get, I try to tell them, dude, this is, you know what I mean? Like, you're not even going to know. None of us are going to know until 20 years down the line, 30 years down the line, 40 years down the line. There's no clinical trials that I know about. And if there was, I mean, I've floated some conspiracy theories out there, but the clinical trials is on the guinea pigs, it's on the populace, and that's what you're doing by going out there, stepping out there, and getting the jab ski. And you ain't gonna find out for 20 years. And you know all the stuff that ends up happening to you, all the slow burn shit. You know what I mean? Dude, my memory is fucking gone. Like my short term, like if I fucking put something down, if I put car keys down or something, unless I hang it where it's supposed, if I don't put something where it's supposed to go, like say the key rack or whatever hanging on the wall, you know, you put the keys on. If I don't put that there, if I put it almost anywhere else, I will be searching and asking for it and losing my mind over it. My short-term memory is horrible, horrible. I could forget something when I just put it down and I walked away, and I come back and I'm like, where to like there's somebody moving shit around on me. I mean, that it's horrible. So if I could help anybody, you know what I mean, by encouraging them not to, and then when they say, well, what's your experience, or how do you know you're not a doctor? I don't need to be a doctor. I was a guinea pig. So I'm sharing this. Bikes, whoops, oh shit. Let me know if you want a link, if you want to comment in on this, if you just want to talk some shit about what's going on. I mean, I think we're going to do a little bit of it all. Come on, motherfucker, I need the link. It's going to be right here, bikes, up in the Chizat, just like always, so.
Yeah, I mean, I think, you know, what I tell people who, you know, come in for research who might not be part of the VA system, I tell them it's really important to at least get your name on, you know, one of the registries, because that's what helps us to understand what's going on with people.
Right. And then obviously, kind of like Agent Orange was, you know, 20, 30, 40 years down the road, if something all of a sudden you guys discover that, you know, wow, you know, bladder cancer seems to be just a really prevalent, you know, disease in Gulf War veterans.
Right.
And now if you're on the, you know, now you're taken care of to a better extent than if you were just on your own.
Exactly. And that's true, because for a while, Lou Gehrig's disease, ALS, that was increased, but it seemed to be like a period of time when that was increased.
Okay.
And then sort of like, you know, went back to its, you know, regular level of, you know, findings within a population. But, you know, brain cancers, different forms of brain cancer, sometimes they emerge, or, you know, like we're talking about with the Vietnam vets with Agent Orange, you know, dementia is becoming really increasingly prevalent in that population. So, you know, is that going to be the same thing in Gulf War veterans? We don't know, but it certainly could be.
We're starting to get close to that, though. I mean, you're talking over 30 years ago,
right?
Gulf War. Okay, so I come in with symptoms. How am I diagnosed? Is it I have these symptoms and I was in the Gulf War, so I get the blanket Gulf War illness diagnosis, or how does that all work?
Right. And so, you know, the CDC came up with criteria very early on after the conflict. And what they were describing based on these questionnaire and physical health symptoms was that there were really 3 different body systems that were, you know, being implicated. And that was like fatigue, cognition and mood, and then musculoskeletal pain. And that's really been pretty much the like concrete definer.
The skeletal pain is the most awesome
population.
one.
Okay.
Research is a little bit different because there's something called the Kansas criteria, where if you have like stroke syndrome or, you know, chronic heart disease or diabetes, etc., then that's an exclusionary criteria, and that's really more for a research community. But what's nice about, you know, using the CDC criteria is that it is over-inclusive. Okay. So that it means that, you know, more people are, you know, in this, you know, fit this criteria, which means they're not going to get lost in the shuffle and not get care.
Right.
Um,
Based on, they're
right.
not fitting the exact norms of what's been typically seen.
At this point, it's still necessary to show the exposure before you are given any sort of disability status.
Right.
And of course, that's been in the news now with individuals in Washington trying to get that reversed.
So you said an interesting point a few seconds ago, and that is that there's some, mental illness components to this.
Mm-hmm.
How then do you differentiate between, is this a PTSD related, mental illness issue, or is it Gulf War, or is there really no differentiation?
Right. And, that's really interesting too, because, there aren't really high rates of what we think of traditionally as PTSD in the Gulf War veteran population, right? It's probably like 5 to 7% or something in total. But we do see that individuals who have exposure to these toxic chemicals have PTSD that is longer lasting.
Oh, okay.
So it's sort of like the double hit, right? It's the toxic exposure and the exposure to, trauma that is, making these symptoms perhaps last even longer. So that's what's, we've been finding time and time again that, toxicant exposures, because where they sort of land in the brain, they increase levels of depression and increase levels of anxiety. So it's not, neurologic and psychiatric disorders can't be, it's like psychiatric disorders are neurologic disorders, certainly.
Right. You're right.
So you can't really say, it's only psychiatric, right? Because it's, it's caused by something
There's a
neurologic
medical issue in the brain as well.
But what's interesting is just how they tie together, right? So that they make each other worse.
Okay, interesting.
Now, is it on purpose or is it on accident?
I guess my next question then is, okay, I have some of these symptoms. You guys diagnosed me. I served in the Gulf, so okay, yep, it looks like you're a stereotypical or not Gulf War illness person. It's been over 30 years, so what are my treatment options? How are you guys, how are you guys going to take care of me?
Right. And so there are a couple of things that have been going on. Because this is like a chronic multi-symptom illness that, until very recently, VA wasn't even allowing studies, or not allowing, but they weren't like making a huge push to do treatment trials because the etiology, the cause, wasn't really well known enough to start doing treatment trials. So Department of Defense had certainly, managed to fund some treatment trials. Like there were a few early on with exercise and cognitive behavioral therapy. And then later on, there have been a number of different studies that have used also exercise like Tai Chi, but also things like dietary supplements. So coenzyme Q10, which is really just to, increase the immune response. So now there have been a number of different studies that are ongoing, and there's actually a huge treatment trial. It's called WICTIC, and I'll give you a link to that.
Awesome.
But they're trying a number of different dietary supplements to see just which will be the most effective. And I think what it's going to come down to is that certain symptoms will be better treated by certain different dietary supplements because they are coming from, although, certainly coming from neurotoxicant exposure, but maybe taking a different path, right? Because some of them are, within the nerve cells,
right,
and others are within the surrounding nerve cells. So there will be different types of treatments that will be beneficial.
Is there any prognosis on the effectiveness of these treatments?
So, like statistically speaking, there's certainly relevance and there's certainly evidence to suggest that they are helpful in reducing symptoms of Gulf War illness. But again, it doesn't, at this point anyway, we're not at a point to say, the whole syndrome, for lack of a better word, this chronic multi-symptom illness is, can be alleviated. Not yet.
Well, I think that's the interesting point too, and that was going to be my next question as far as, it's been more than 30 years, and so are we any closer to a cure? But you've kind of answered that in the sense of, it's not like, okay, I have diabetes.
Right.
This is, I could have muscular issues, I could have mental illness, there's so many parts of the body, I guess, that are effective. There's not like, okay, we're going to give you this vaccine and, Gulf War illness is going to be a thing of the past.
Right.
It's like you're just all fucked up and there's nothing.
So I guess, I kind of answered my own question. We're probably not at the point where we're looking for an overall
Mario,
cure.
I put a link in there if you want to jump in.
Probably at the point where based upon each individual.
I guess I'll pause this and talk a little bit. Sitting here eating my fried chicken, my air fried chicken. So it's a host of shit that they ain't got no answer for. Best bet, if you're exposed or you got these vaccines, two things. You try to jump through the hoops of the VA. Hopefully they don't try to stick you with more shit or put you on pills, because I'm pretty sure at any time, at any point, anybody that's ever been to the VA or even, the civilian hospital out of the military, the easiest option for people to do is just pump you full of drugs, sleeping pills, pills, mood stabilizers, blah, blah, blah. It's easier for them to do that. I mean, I'm really blown away that the VA is even talking about this, because, hold up. I still got to run the business, so duty calls, but I'm still here. That's why I end up having to cut all these short and run, but I'm good right now. Except for I forgot where I was. So if you want it, the best two things you can do, I guess maybe that's why I'm beating this to death, is, number one, try to get some compensation. It's got to be monetary compensation, because there's no way they could fix you. There's no way they could prescribe you enough drugs to fix you and put you back to normal before they started using you as a guinea pig. The fact that the VA is talking about this is kind of interesting, but, they don't have no culpability because it's DOD's fault, right? It's Uncle Sam's fault. It's not Department of Veteran Affairs. Number two, don't let people around you be guinea pigs and take unproven vaccines, That number two. This air fried chicken is not bad, let me tell you. So, yeah. I'll just be chilling on here for a little bit if anybody jumps in, but other than that, keep going. It's almost over anyway.
Situation, we can prescribe a treatment plan that at least improves their quality of life.
So I think that yes, ultimately that will happen. You know, sort of the main focus now is because there's what's called neuroinflammation. So this inflammatory process that's in the brain that's causing cells to not work as well, to slow down and, you know, to not be able to transmit their signals as quickly. So, you know, working on these cures to reduce neuroinflammation, that will certainly be a big help.
Okay. And you brought up an interesting point, I think, that is really starting to bubble to the surface more and more with a number of different things, including the current health crisis that we're experiencing. And that is kind of getting back to just good dietary habits so that you're getting basic vitamins and minerals that your body can then use on its own. You know, and I guess people, you would think something so simple would be so obvious, but I guess they've found that in a lot of these cases, people have, very low vitamin D levels, or,
Right.
The B series is out of whack. So, that's interesting. That's something that you could probably just do over the counter, may be able.
Not to be messed up or anything, but I mean, I always just got to keep it real like I always do. This guy should not be talking about any fucking type of health or anything. I mean, I guess he's just giving a play-by-play, but this is the worst guy to be talking anything health or, you know what I mean, at all. I mean, like when you got fat cop chasing you, it just doesn't make sense.
Term to help you and once again, give you a better quality of life.
Right, exactly. Or, getting something like coenzyme Q10 in a, that's in a higher potency than you can get over the counter. Maybe that's, something that would be beneficial.
That would be so fantastic. I mean, something, God willing, something as simple as that can really help folks out. So you kind of touched on it a little bit, but okay, I'm a veteran or I'm a family member out there. I'm seeing this video and I'm like, ooh, okay, yeah, dad, mom, whatever. Yeah. Where do I find more information? Where can I go?
Sure. And so the first thing I would do is to go to a local VA and make sure that I'm on the registry or my loved one is on the Gulf War Illness Registry or Gulf War Registry.
Now, just real quick, let me jump in. Can you do that online on the VA's website, or do you actually have to do it in person at a VA medical facility?
I don't know.
Good
actually.
Question. Huh?
I don't know, but we will find that out.
Right. We'll find that out and make sure that link is below if you can actually register or online instead of having to.
Right. I know historically you couldn't do it online because they wanted to do a medical exam and they wanted to see the paperwork, although now you can scan it in, so it's very possible that you can.
Okay.
There are also a couple of websites. There's something called 91 Outcomes, which we will also put a link to. One of our own Gulf War veterans who's been very involved in research in Department of Defense and has been collecting lots and lots of information. So there was something called the Research Advisory Committee for Gulf War Illness through the VA system. And Anthony Hardy not only was part of this process, but also started this website to put all sorts of information about, where you can go for this and where you can go for that. And also what research is going on now and how you can get involved in the research. Because of course, the more we know, the more we can provide care.
Absolutely. Okay, and those links will be below.
Exactly. Yes.
Dr. Kringle, anything else that we didn't touch upon today that you would really like the public or our veterans to know about Gulf War illness?
Just that, we are really trying to make sure that this does not repeat. I mean, already, Department of Defense changed the quantity of DEET and, was really much more careful about the pesticide exposures and even the vaccines. But we really still need help to, figure all of this out. So anybody who is interested in,
So whatever the numbers are, who knows, who knows how bad it really is. But I had this. I wanted to share it. Maybe share this with somebody who's on the fence that you're trying to convince, or maybe a loved one that you're trying to convince that, don't be getting, guinea pig jabs. So something you could share, something you can look into. I'm sure there's lots of links and stuff with it, but I'll probably maybe detail my little journey through it, going through the VA. We'll see. I mean, if it becomes, if it's such a headache to go through the VA, at least maybe I could go to my doctor with this info and maybe get something better. But to jump through the hoops is how you get some monetary compensation for this. It's not anywhere close to what it is for really destroying the length of your life and the quality of your life. Who knows how long most folks would ended up living to. How do we know? I mean, what quality of life they would have been living um, through all that. So questions. I'm just gonna keep putting the info out. I shit on all those fucking everybody on TV and all them politicians yesterday. I don't give a fuck about none of them. They're all fucking liars. And the fact that more people are not as angry as I am is kind of discerning. Is that what I'm looking for? Definitely concerning. Kind of let me down here, but yeah, they stuck me with the poison jab skis, but I'm still here. Oh, man. Dog out there tearing stuff up. What up, Tommy Stock? It's been a long time, bro. But they hit me with the poisonous poisons, and I'm still ticking like a Rolex watch without being all nice, or whatever the opposite, whatever kind of watch out there is tough and ugly. That's me. Yeah, I thought I'd share this. Let me know what you think. Comments, shares, likes, all that good stuff. Peace.